Doktora, ask ko lang po ba anong mabisang herbal sa may bukol sa atay? Doktora, ask ko lang po ba anong mabisang herbal sa may bukol sa atay or lumalaki na atay? Well, if you have a mass in the liver, it can be because of cancer. It can be because of a cyst. If it's a cyst, it can be parasitic in nature. So I don't know if you're familiar with hydatid cyst or echinococcus. It's a parasitic infection. It's a tapeworm. Actually, someone asked me about that. Also, it can also have you can also have cyst
when you're a little kid.
You can also have cyst in the brain. So it's echinococcus hydatid cyst. And it's very, because you can get it from the poop of animals as well, sheep and dogs. Yeah, so they are the intermediate host.
So don't be playing with any poop.
Right? Yeah, so sometimes we take that. Okay, so that's why we develop. Also, if the liver is getting bigger, probably there's an inflammation. So inflammation can be viral, drug induced. It can be because of cancer. It can be of many bacterial or amoebic. Okay, so these are the reasons why you can develop them. And garlic, dandelion, milk thistle, silimarin, di ba? Naririnig nyo yan. So, if you talk about tumors, generally in medical terms, tumor means just an enlargement, like a new growth. Yun po. So, it doesn't really tell you if it's cancerous or benign. So, pagka may mga tumor, pag may mga enlargement po tayo or tinatawag po natin na new growth, so maraming dahilan, okay? So, you have to ask your doctor first, what's the most common reason bakit nagkakaroon ng tumor mass, one of the most important risk factor of developing liver cancer, it's hepatitis B. So if you have hepatitis B, you would usually have, you would develop liver cancer eventually around 200 times higher. 20 to 200 times higher. So kapag nagkaroon ka ng hepatitis B, almost always nagkakaroon din sila ng liver cancer, di ba? Nakakatakot. Also, if you are drinking, so if you're a chronic alcoholic drinker, and some medications also that you are taking in, some medications for the that you are taking in for maintenance, you would also develop some types of liver tumors.
Well, there's no medicine, no medication that doesn't have a side effect.
Yes, parasitic infection also. Pagka meron ka mga schistosoma, yung tinatawag po nila. And you can also develop some form of, or amoeba, amoebic. Yan, pwede ka rin magkaroon ng tumors because of this condition. So, what you can do is that, as a herbal, in herbs, you can use garlic. Yan. Pinakamaganda ho dyan, garlic, dandelion, yan, mga milk thistle, yan, magagandang herbs for the liver. And of course, megadose vitamin C. That's what I usually do, especially if there's a damage in the liver. The megadose vitamin C will help you a lot. And garlic. And then, if it's damaged, you do an SGPT, SGOT testing after 1 month. So you see if there's a result. For liver diseases, garlic. Okay, garlic po the best. Okay, garlic and as well vitamin C, megadoses.
Megadose of vitamin C.
So if I say megadoses, it's around 5 grams up until 100 grams per day. Magtatai lang ho kayo, you're just gonna have diarrhea. So, but it's one of the best vitamins that was ever created.
Megadosing of vitamin C was established as far as being safe and effective by Dr. Linus Pauling, who has the only person ever actually win 2 unshared Nobel Prizes, and the University of Oregon actually has the Linus Pauling Institute there. So
yes.
When it comes to vitamin C, again, we often hear folks say that megadoses of vitamin C can lead to kidney stones. I'm sure many of you heard that from folks and doctors as well. Just so you know, there is no study in the sum history of medical literature that demonstrates causation for elevated levels of vitamin C intake and kidney stones. It just doesn't exist.